Hey, it's Dr. Micah, board certified rheumatologist. Welcome back to my channel. Today we're going to be talking about one of my favorite topics, supplements. And we're going to talk about my top 3 favorite supplements for rheumatoid arthritis. Now, you may be wondering, why didn't my rheumatologist talk about supplements? Or you may have gone to your rheumatologist and asked your rheumatologist, what supplements can I take to help with my rheumatoid arthritis or psoriatic arthritis or whatever type of arthritis? And most likely, they didn't give you much of an answer. They will tell you to do your research online, or they will tell you, oh, you just take, I don't know, some turmeric or something over the counter. But they really don't know what you can take, because taking supplements and finding out what supplements can work for patients takes more education. And conventional medicine and rheumatology, just like the way I was initially trained, does not teach you anything about herbs or supplements or diet. And I had to get extensive education beyond just rheumatology in integrated medicine and functional medicine to learn how to use supplements for my patients. I use supplements all the time for rheumatoid arthritis. Now, that's not to say that I don't use conventional medicine. I still use conventional medicine such as DMARDs and biologics. However, I use supplements either to 1, augment the therapy for patients, or number 2, to use it as a main part of treatment because their arthritis isn't that severe. I will use conventional medicine initially, right away, if patients are having a severe form of arthritis or are flaring a lot. Some patients of mine, they come to my clinic because they want a balance of supplements and conventional medicine. They don't want to just be on conventional medicine, or they want to avoid the medications completely, which I completely understand, because I have arthritis as well and I didn't want to take any meds, including biologics and DMARDs. Now, when I mention DMARDs, I mean methotrexate, leflunomide, sulfasalazine, and plaquenil. Those are just examples of DMARDs. So DMARDs have less side effects than biologics, and they are less strong as well because the biologics target a specific part of your immune system, whereas the DMARDs generally attack the general part of your immune system. The 3 supplements I'll be talking about are not only based on my experience as a patient and a doctor, but also on research as well. Now, don't get me wrong, I still use conventional medicine in my office as needed. So when a patient comes to me with arthritis, I will assess them first to see how severe their arthritis is and how much flare they're in. And if they're in a lot of pain, very severe pain, of course I will jump straight to medications such as DMARDs. And if you know what DMARDs are, they're methotrexate, leflunomide, plaquenil, sulfasalazine. Those are the DMARDs out there, or there are biologics, and I will mix and match either one of them. But if a patient is not that severe in my office, I will use supplements to see whether it can control their disease, of course on top of diet and other lifestyle modifications. And in most cases, I actually combine the 2. Now, let's talk about the first supplement today, and it is turmeric. Turmeric comes in so many different forms. It comes in supplement form, spice form, and the root form as well. When I do my cooking, sometimes I like to shave some turmeric onto the food, or I put it in as a spice as well, or even put a dash of it in my smoothie. What you do need to know about turmeric is that it's better absorbed when you use black pepper, or in some cases, some turmeric supplements will say piperine on the ingredients. One thing I don't like about turmeric is that it can stain my clothes very easily. It's an orange color, and it's also very good. They use it in a lot of Indian cooking as well. It tastes very bitter, but it's one of my favorites. So sometimes if I'm in a flare, as you know, I do have arthritis if you watch my previous videos, and I will take a couple pills of turmeric, and studies have shown that up to 12 grams has been used in studies. And the biggest side effects of these subjects who did not have any arthritis, from what I remember, they were normal individuals without any diseases. They had some yellow stool, orange stool, some had diarrhea, some had abdominal pain, and 1 or 2 individuals had elevated liver enzymes. So turmeric overall is pretty safe, but you gotta be aware that there are cases of turmeric causing elevated liver enzymes, particularly in the supplement form, because the supplement form is much more potent than the food form. I myself take about 2 grams when I have some pain, or even a little bit more, but each dosing depends on each individual. You can't copy what someone else is doing because it depends on your body and what medications you're taking as well. For example, turmeric is a little bit like a blood thinner. So if you're taking Coumadin, warfarin, or other anticoagulants, you do want to be careful of turmeric, because turmeric will thin the blood a little bit, and you're taking these antiplatelet or anticoagulant or blood thinning medications, and they can make bruising much easier for the patient. And you're probably asking, is turmeric only good for rheumatoid arthritis? No, it's good for so many different diseases. There's over 6,000 published articles on turmeric talking about cancer. It can potentially fight cancer. It can fight different diseases that are inflammatory. It can help with psoriatic arthritis, lupus, multiple sclerosis, rheumatoid arthritis we talked about already. It can help with gout as well. It can help with inflammatory bowel disease. There are studies on that also. There are studies on it with memory problems, Alzheimer's. There's so many different studies out there. If you have any more questions on turmeric, leave a comment below and I'll get back to it as soon as I can. Supplement number 2, vitamin D. I think this is my ultimate favorite supplement. Vitamin D is so important. The sun's really important to help you get vitamin D, but you can get it in a supplement form, and it is so good for you in so many different ways. Not only is it good for your bone, it help absorb calcium from your intestines, but it's really good as an immunomodulator. Not many people know this, but you have vitamin D in a lot of immune cells in your gut receptors as well. So there are receptors in your gut and also receptors in your vitamin D waiting to grab onto that vitamin D to help it perform its function. And if you have low vitamin D levels, it can cause a leaky gut. There are articles on this. And vitamin D can also help with T regulatory cells, which are anti-inflammatory. So if you have low vitamin D levels, it can actually make you flare more with arthritis and autoimmune diseases. And that not only starts with rheumatoid arthritis, but it is also studies in lupus, multiple sclerosis, and also inflammatory bowel disease. So I try to make sure my vitamin D levels are normal, and the range I like to put my patients at and myself at is on the upper range of normal. So it depends on what country you're from and what lab you're using, and that upper limit of normal for your lab could be 50. The ones I use are normally 100, so you gotta be aware of the level of your lab. I check the vitamin D levels on my patients at least every 3 months. If you see a rheumatologist and they don't check your vitamin D levels, you should ask for it, because vitamin D is so important for your immune system. If you have low vitamin D levels and you don't know that you do and you're not supplementing, then you can potentially get more flares, because like I said earlier, remember that vitamin D is anti-inflammatory and it modulates the immune system. So it's like another medication without the side effects if you take it in the right doses. Now you might be wondering, where else can I get vitamin D besides supplements? Well, there are food sources of supplements, surprisingly. Not only can you get it from vitamin D from the sun, but you can also get it from food. Now the foods that have vitamin D are fish. They are also in mushrooms, eggs, and fortified foods. So sometimes you see your dairy, your plant-based milks, your orange juice, sometimes they'll fortify it with vitamin D. So those are just some of the places that you can get vitamin D from. Number 3, omega-3 fatty acids. This is another essential supplement to fight inflammation and arthritis. So omega-3 fatty acids can come in different forms. You can get it from fish as a fish oil, or you can get it in algae oil if you're vegetarian or vegan. Not a lot of people know this, but actually omega-3 fatty acids that are found in fish actually come from the ocean and algae. The fish eat the algae, and the algae is the main source of omega-3 fatty acids. For omega-3 fatty acids, if you're vegan or vegetarian, if you take a lot of chia seeds and flax seeds, which also have omega-3 fatty acids, you get the ALA form, and that doesn't bioconvert that well to EPA and DHA. EPA and DHA are the final forms of omega-3 fatty acids that we want in the body that help to resolve inflammation. And chia seeds and flax seeds, although they have omega-3 fatty acids, they don't have the forms that we need. So yes, when you eat chia seeds and flax seeds, ALA will turn it into EPA and DHA, but not that much, about 15% or so. And as far as dosing for omega-3 fatty acids, there was a study out of the American Journal of Nutrition that showed that about 12 weeks worth of 3 grams of omega-3 fatty acids showed anti-inflammatory clinical response. So that's where I like to put my patients near, is about 3 grams. All right, here's the bonus. I know I said I was gonna talk about 3 supplements, but now we're gonna talk about 2 more anti-inflammatory supplements. The first one is Boswellia. And if you guys use essential oils, the frankincense, Boswellia is frankincense. Boswellia comes from the Boswellia serrata tree in India, and also it's used in Ayurvedic medicine. And Boswellia is one of my favorite ones. You can get Boswellia in a supplement form from itself, so it can be in a solo form, or it can be combined in other supplements. I know there are some supplements on the market, some brands that combine turmeric and Boswellia as well, and that can be pretty powerful combo. And the primary compound of Boswellia is boswellic acids, and it's been studied in journals dealing with arthritis, and there are positive associations with Boswellia and resolving of pain and inflammation. Okay, number 5. My number 5 most favorite supplement for arthritis is MSM. Now, when I say MSM, my patients always look at me confused, and especially if I say the long form, which is methylsulfonomethane. It's a mouthful. So MSM is a supplement, and it is naturally found in plants and animals as well, but you can find it in a supplement form. And it has also been found to be anti-inflammatory and can help with joint pain. So MSM, of course, it's a great supplement and it can help with arthritis, and there are studies for this. So there are many different brands you can buy this from, and they can range from 500 milligrams a pill to up to 1,000 milligrams a pill as well. As far as dosing, it really depends on the patient. And with all these supplements in general, yes, they're generally very low risk, but of course, any supplement can give you side effects. You can get nausea, abdominal pain, diarrhea, and one thing I always tell my patients is to watch out for elevated liver numbers. So you gotta be careful of that. I've seen reports, I've seen patients come in the hospital in my past that had elevated liver enzymes, and the only thing we can point it to was to their supplement, and this could also be known as drug-induced liver failure or drug-induced liver injury, also known as DILI. So just be careful of that, but in general, I really like supplements. I use them a lot in my patients. These are just 5 of the many different supplements I use in my office, and it can help with arthritis a lot. So whether you have rheumatoid arthritis, psoriatic arthritis, gout, ankylosing spondylitis, these supplements can help. But not only can these supplements help with arthritis, but they can also help with other conditions as well, such as lupus, multiple sclerosis, and any inflammatory condition. I just didn't review all the evidence of these supplements with all these different conditions, but that's for another episode. Alright, so today we talk about supplements. Comment below and tell me what else you want me to talk about in the next episodes. And if you try some of these supplements and it didn't help, let me know. And if you want to see me in clinic, I see patients in the USA and all over the world at www.drlifestyle.org. And of course, don't forget to hit that like and subscribe button so you keep following me for new videos.